Well, first, welcome everyone to this 1 hour session with Dr. Deborah. Thanks a lot for being here.
Happy
Just to
to be
give you,
here.
first introduce to Dr. Deborah Dawson. So, Deb, I'm very happy to tell you, as a Canadian who's made a big difference in the world of psychotherapy. We're always particularly proud we have Canadians on our screen and working with us. She has a PhD in clinical psychology. She's had a decades-long career specializing in social anxiety disorder treatment. She's adjunct professor at the University of Psychology at the University of Calgary and the former director of the clinical training program Calgary Clinical Psychology Residency Program. She founded the first certificate program in CBT in Western Canada in 2014, and she's also won a Governor General's Award, the Caring Canadian Award for her mental advocacy work. She's co-author of Evidence-Based Practice of Cognitive Behaviour Therapy. It's a widely used textbook. And now she's just come out recently with Living Well with Social Anxiety, Practical Strategies for Improving Your Daily Life. And this is a book written not only for therapists, but really for people struggling with social anxiety. So, Deb, thanks a lot for being here with us.
Thank you very much for the introduction. Makes me a bit tired to hear it all,
So
but
my
it's
first question is, which is generally the first question I like to everybody is, you've had this impressive career in academia and in clinical practice. So what first sparked your interest in CBT, and then moving from that, your interest in working with anxiety?
okay. I went to Western University, formerly University of Western Ontario, and it was really in the early days of CBT back. And I sometimes would say to students, I went to school when it was big B, little c. So we learned much more about behavioral therapy than cognitive therapy. It was early days then. Um, but that interest was sparked early on. And then you didn't mention, but my early days actually in CBT when I was in practice were in this area of schizophrenia. And so I started out with severe mental illness, but then gradually over a few years in practice, I really saw a gap in the program I was working in, which was here in Calgary at Foothills Hospital, where there was no treatment for people with social anxiety. And it was really apparent to me that it was a very common difficulty and something that could be treated and should be treated. And there were a lot of people at that point working in the area of schizophrenia here in Calgary. So I saw a gap and I took advantage of it and started both some research and treatment in social anxiety back in I hate to say it was in the early 90s, I think so, a long time ago. And so I practiced in the area of social anxiety for quite a number of decades, actually. So that's my interest was sparked and continued to be sparked by a development of treatment and the interest. There was never a shortage of referrals for people with social anxiety. It was a common problem and lots of need and interesting to work with. So that's the how it started.
Well, I think in my connection with people with social anxiety, I know young people see the social anxiety starting out when they were 8, 9, 10 years old, some awkwardness. And
Mhm.
is that fairly common, or just sometimes it kind of blossom later on, the kind of discomfort in public?
I would say both happen, but if you ask, one of the questions I ask client, and I'll be talking about assessment in the upcoming workshop, but I would ask, were you shy as a child? And almost everyone says yes. So but that doesn't mean that all shy children grow up to be socially anxious adults. So about 40% of children are shy, and about 8 to 10% of adults struggle with social anxiety. And so usually starts young, usually gets worse at times of transition, like high school, early adulthood. And there are a few times where people are not shy as children, but it can develop after a period of isolation. Yeah, for example, if someone had a chronic medical illness during formative years of high school, or other formative years, then they lose out on opportunities to develop social skills. And oftentimes, that can lead to a lot of anxiety trying to get back into social life, including COVID, actually. Yeah, that was one of my big worries at the start of COVID, is not that it was going to lead to a lot of difficulties with, say, panic disorder or even OCD, but social anxiety, because avoidance is so easy was so easy, and it continues to be easy.
And what was the effect of COVID, and do you notice any post-pandemic effects in more recent years?
Hmm. Absolutely. We've all heard about the increase in difficulties with mental health since COVID. Excuse me. I think that's partly due to increased awareness, but partly due to the lengthy period of time that people lived in relative isolation. And so, yes, I would say there's a lot of people struggling with social anxiety, and social avoidance has become quite normalized with, everything that we do online. It's so easy to not be out in a public situation currently.
Now, do you notice, lately there's been a lot of written about AI and chatbots. Toronto Life magazine lead article is someone who is experimenting. And I would imagine for people with social anxiety, it might be something they might lean on. Do you have any thoughts or
Hmm.
any experience with AI and the effect of these chatbots on people with social anxiety?
I haven't actually really thought about that one, Michael, but I would guess so. I think anything that can be leaned on as a crutch, including AI or including, avatars or, chat boxes, I think not having cameras on, for example, relying on anything external that can help boost perceived confidence, I think would cause problems.
Okay, now I want to just go back to how can clinicians distinguish between just everyday shyness, someone coming into their office, and social anxiety?
Uh-huh.
What are the signs?
It's a really good question, Michael, and I think that all of the strategies that are discussed, we'll be discussing some of them today in the upcoming workshop and in the book, c- could be used for people with shyness. I think that I really see it on a continuum, shyness being the kind of low end of the continuum, social anxiety disorder in the middle, and then avoidant personality at the most severe end of the continuum. And so distinguishing features, I think, between shyness and social anxiety would include the degree of distress, the degree of avoidance. If a person is shy, introverted, they might be completely comfortable with that. They might be quite happy with that. And I would say that's not a problem, unless there's something they want to change about that. And so distinguishing it in clinical practice, if someone comes to see a therapist and they're describing themselves as shy, but wanting to make some changes in their life, I think that, diagnosis doesn't matter so much. I think any of the strategies can be used.
Are there any particular questions in an assessment that people might use to, again, help to distinguish this?
Hmm. There are a lot of questions. In fact, I have a semi-structured interview that I've developed that I'll be sharing. But some of the questions include, one that I like because it's a bit tricky to distinguish between panic disorder and social anxiety disorder. And a lot of, clients coming in, they don't know the difference. So I sometimes ask, if you were going to a large mall, like, a Toronto mall or Calgary mall, wherever it is, and you could be there and there are no people around, would you be comfortable shopping as long as all the shops were open and you could do on, some kind of virtual shopping? Would you be okay with that? And socially anxious people tend to say yes, but people with panic disorder tend to say no because they're worried that if no one's around, they won't have anyone to ask for help. If they have a panic attack, they'll be up a creek. And so I think that's one of the questions, are you comfortable being in a crowded place versus not? I think the key question, though, is, and this is one that most of us, I think, can resonate with. How much do you worry about other people judging? Or how much do you worry about people evaluating your every move? Think that people who are socially anxious worry excessively about judgment, worry that they're judging negatively, never positively, but are judging negatively. That's one of the questions. And then it's also important to figure out what are the specific situations that people are uncomfortable with. It, oh, sorry, I heard. Sorry.
I think
Okay.
that just go on.
Okay. Um, sometimes they're very specific situations like fear of speaking in public affects lots and lots of people. About 90% of the population has a fear of speaking in public versus just a few, sometimes fear of eating in front of other people, doing something in front of other people versus initiating social contact, saying hello to people, making friends. Socially anxious people are often comfortable once they get into a relationship. They're often very loyal and true friends, but it's hard to take those initial steps. The initial steps of friendships, initiating things like job interviews, applying for jobs, initiating something in a classroom, educational opportunities. And so those would be some of the things I would look for.
Now, your new book, Living Well with Social Anxiety, was just published this year, and it's written both for professionals and for offering practical tools for people
Hmm.
who are struggling. You wrote the book on CBT a number of years ago. What inspired you to write this book now? You're getting closer to retirement. So why now? Why this book?
It's a very good question, and it came at a really interesting time. So bear with my sharing personal information with you, Michael, but
Just
I
us and those other people on the screen.
I I worked for a long time with people with social anxiety, and I developed a group program that I conducted for many years. And I also did lots of individual therapy and some community treatment as well. And so I had developed a lot of different tools and strategies and, practical things because I really, really like to be practical. But I had never written anything like a book for the general public before. I'd always written more academic type clinical practice books. And in the spring of 2023, I had decided to retire from clinical practice. And I had let my registration lapse at the end of March 2023, which was kind of a poignant time for me. I've since, retained my academic connection and done lots of teaching and consultation and writing, but I stopped my clinical practice. And then about a couple weeks later, I got a call from Guilford Press offering to have me write a book in the Living Well series. And so it came at a very interesting time because I had always thought I would like to write a book like this, but never really had the opportunity. And so they were developing the series, which I really like the concept of the series. The series is very realistic, how to live well alongside a problem that you have. Because as we know as clinicians, that problems don't magically disappear. And, particularly social anxiety, which is something that, as you mentioned, has an early onset, people often think of as just part of who they are. And so I decided to accept and wrote the proposal for the book. And it was a kind of a interesting project to do, actually, writing for the public as opposed for an academic or clinical audience. But I think, very useful, hopefully, for clinicians. But it was a chance for me to do a deep dive into all the different tools that I had talked about with clients over the years and put them all together in this package. So that's how it came to be.
And the Living Well series, and are the other books in this series also for general public as well as for
hmm
therapists?
Yeah, they're
Well,
all
I'm
there. So there's about four, I think, or four or five published. I think I was
interested.
the fourth or fifth one.
You should look into this. It's an
hmm
interesting idea. Do you, in your long career, have you seen a change in the volume of people with social anxiety coming to therapists' doors? Is it or screens? Is this something that's growing, staying the same? Uh, what do you think?
What do I think? I'm not sure, Michael, and I'm not sure I'm the best in some person to ask in some ways because, you know, f- early on when I first opened up referrals, you know, I've I never had a shortage of referrals, and I tended to always have a waiting list of referrals. And so, um, are there more now? I'm not sure because I think they become much better at avoiding. And, and because I haven't been in practice for about 2 years now, I still get requests and I have to turn them away or refer them to someone else. But I think there's a healthy number of referrals. But I would also say many of the people that are referred or self-referred will come for another problem. I think that people with social anxiety often have secondary problems that are a consequence of the social anxiety. So depression, it's depressing if you're isolated and anxious and want to be in relationships with other people. So people might present with depression, they might present with substance abuse, they might present with panic attacks, but underlying this is a primary social anxiety that is really driving the whole situation.
Interesting. And actually, this is something the viewers of this program today could weigh in on. If you have thoughts, you could put it just your thoughts in the chat line, or you could come on the screen later on when we're going to open it up for you to engage in conversation with Deb. So, Deb, CBT always has a strong evidence base,
Mhm.
and now for treating social anxiety. So, what specific components of CBT do you find most effective in creating lasting change with clients?
And that's the key, I think, the word lasting change, because I think if you look at most of the clinical trials for CBT, they offer maybe therapy with 12 to 16 sessions and have good initial outcomes, but the changes may not last. And I think the evidence for social anxiety and CBT, while it's fairly strong, I think there's a lot of room for improvement. And I think that, lasting change, and I would say to clients at the end of therapy, there will be ongoing struggles. I think that's just being realistic. And I think that people, I think, should be encouraged to come back for help at transition times in their life because, CBT may, you know, about two-thirds of people are probably going to make significant changes with CBT, but they also will have likely difficulties in the future should they move to a new city, have a job change, have a marital breakdown, something significant changes in their lives that puts a lot of social stressors on them. I think that, and so to make lasting change, I think people have to really take ownership of their problems. And I think for people with social anxiety, that can be more difficult than for many people because people with social anxiety tend to be lovely clients because they look up to the therapist. They tend to be a bit deferential. They tend to be a bit unassertive. They tend to lack confidence. And so I think whatever steps a therapist can take to help people take charge of their lives. And so for therapists, this may be doing things where they build in early successes in treatment. How you take every win you can and help the clients take personal attribution for change. I think that, rather than say, well, I couldn't have done it without you, the therapist, or I couldn't have done it without medications, or I only did it because I took a shot of alcohol before I went to the party. I think if a client can really be encouraged to take credit and then build in follow-up plans after treatment, see the client every few months perhaps, and then have the client really think about how they can take charge, set their own goals, and take advantage of every situation they can socially.
Here's a question you might have gotten before, maybe not. And I know what I'm finding in speaking to therapists that there are more integration of different techniques, including
Hmm.
CBT, into
Hmm.
wider practices. This
Hmm.
wasn't always the case.
Right.
I think at one point people would say, I'm a CBT therapist.
Hmm.
Now they're more likely to say, I integrate CBT with somatic approaches, EMDR, narrative, whatever it is. Do you find there are other approaches that work best with CBT? And are there approaches that are out there that people are using that you would feel less likely to be successful in integration
Hmm.
with CBT for anxiety?
Well, I guess I have to say, as a bit of an academic, there's no research looking at integration,
Oh,
okay,
okay.
in terms of, CBT for social anxiety with other methods. There's some research that's taken place on interpersonal therapy for CBT that was done in Toronto, actually. Um, and so there's group versus individual therapy, CBT, including with medication. Medication for social anxiety is pretty effective, actually. But in terms of integration, um, I think the key point for me is for therapists to really be thoughtful with their understanding of the client. And so I think whatever methods you're using, it's important to have a clinical case formulation from, I would say from a CBT perspective, but if you're practicing from another perspective, another theoretical approach, have a really solid clinical case formulation that you've developed following your assessment of the client. And then the techniques that are used need to be integrated within that formulation, within your understanding. And so I think you can do that, but the methods and the strategies have to be used thoughtfully.
Now, you've supported both individual and group therapy formats,
Hmm.
and how you decide which setting might be most appropriate for a client with social anxiety.
Well, at heart, Michael, I'm a pragmatist. And so I would say, we know that we don't have the perfect methods available that are available to all clients at all points in time. And so, I think a group approach is really useful for clients. And in an ideal world, and there's some research that has been done on this. In an ideal world, you start with a solid clinical assessment. You would do some individual therapy first, and then have the client complete a group approach, and then follow up with a bit of individual follow up. But it depends on what's available. For example, I've been in both uh, public health settings and in private settings. It's extremely difficult to start groups in private practice. I think you have to have a set of clients that are all waiting, they're all available at the time you want to offer the group. So it's difficult to do a group. It's really useful though to have a group approach for clients with social anxiety because you've got a set of peers that you've got a great opportunities to practice skills. You've got great support available. And so, I think I would really recommend a group approach if at all possible. But in the benefit, there's some benefits certainly for a group. There's some benefits for individual that you don't have in a group because the individual therapy is much more individualized. You can really target the issues the clients are bringing in, which you can't do quite as much in a group.
Well, now this is what I'm wondering. Devin, there's a question I would have asked a few years ago. I've been talking to therapists who have hybrid practices.
Hmm.
Some have mostly virtual.
Hmm.
Very few have all in person. Some have some in person and some virtual. So you need to educate me on uh, from what your knowledge is, do you see a lot of therapists seeing people virtually as opposed to individually? And are there virtual groups for clients who would prefer to be in a group virtually? What do you see going on in this world like that?
It's an interesting world because I practiced virtually as we all did for the period of the pandemic. And I think we all thought, oh, this is only going to last a few weeks, so I'll just do it. I thought I'll do it just for my clients that I knew really well, but ended up doing it for 3 or 4 years. Um, I have not done groups online. Other therapists have done groups online, including social anxiety groups. You can do them, and I think they can work really well. Um, it's tricky, but there's certain advantages to online, like the use of a camera, for example, which, you know, clients with social anxiety can't stand the idea of being on a camera or hearing their voice or, being recorded. All those kinds of things make people with social anxiety very uncomfortable. So I think it can work virtually, and I think, I saw many social anxiety clients one-on-one virtually, and there's certain things, for example, facial expressions, you can see much more in virtual therapy. It feels like you're 18 inches away, whereas, that didn't happen in the office. And so I think it can be done virtually for sure. But, I probably old-fashioned enough that I much prefer what in person, but I think both are effective. I
Okay.
don't know of any comparison trials, though.
Mm. Okay, I'm thinking about your workshop next month. It's 2 days, 6 hours, really going deep in this. And so I want to talk a little bit about themes related to what you're going to be talking about. So, are there any common missteps you see clinicians making when working with clients
Mhm.
with social anxiety? What are the missteps people have to be aware of?
I think that, and this would be true not just for social anxiety, but for CBT in general, a lot of people, would come to see me and say, well, I've had CBT in the past. And, they may be familiar with the terminology and some of the strategies, but it's not been individualized enough. I think that clients need to really have a full understanding of how their social anxiety operates and what exactly they're avoiding. Now, we haven't talked so much this morning or this afternoon, I guess, in Toronto about avoidance, but the key element that keeps social anxiety going is avoidance. And people with social anxiety are expert avoiders, and one of the missteps I think therapists make is they help clients avoid. They help clients avoid by, talking about the problems more than taking action on the problems. I think they let clients off the hook by trying to be gentle and really kind. We want to be kind as therapists, but we also want to push our clients a little bit. I would often, and I'm as guilty of this as many therapists are. I would often ask clients for feedback at the end of either individual treatment or group treatment. And, it's interesting the timing of this. Clients would say, well, didn't push us quite as much as you could have. They would say it at a time where I couldn't push them anymore because it was done. But I think that, it's really important that we not enable our clients' anxiety and not enable their avoidance. So help them be brave and do hard things.
And how do you support clients in identifying and challenging core beliefs that reinforce their anxiety?
hmm Yeah, first and foremost, I would say help them understand that beliefs are just beliefs. Thoughts are just thoughts. Thoughts are not objective reality. And take a step back from their thoughts and really learn how to assess their thoughts and learn some strategies to challenge those thoughts. So, for example, learn how to do behavioral experiments. And if a client has a thought, everybody's looking at me and they're judging me, thinking about how can you really know that for sure? Because clients who are social anxiety are often not looking around. They're often looking down rather and avoiding eye contact and not seeing what's available in the world around them. And so learning how to do an experiment, figuring out, well, are people looking at me? Testing out objective reality through the use of behavioral experiments. So we'll be talking a lot about different ways you can test out your beliefs and challenge your beliefs.
And are these tests sometimes in homework assignments that you give people?
Yeah, so
Can
for
you give an
sure.
example of a homework assignment you might give someone, or one that you found has been particularly useful over the years
hmm
when working with people with social anxiety?
hmm There's um, so many possible homework assignments, Michael. I don't know if I could identify
Pick out
a,
one that you think, if you
well,
had a favorite homework
a
assignment,
favorite homework
listen,
assignment.
you have to pick out one.
Well,
What would it
we're just
be?
talking about,
And I know
if
you have to assess each client and everyone's different and all that
right.
stuff.
Yeah, no, for sure. And so if someone has, we were just talking about the everyone's looking at me and no one likes me thought that many socially anxious people have. And so a homework assignment might be going to a public place, like say sitting on a bench in the mall, and rather than looking at your phone, putting your phone away and assessing the crowd, you're looking at how many people actually are looking at me and counting them over a period of time, or smiling at people and seeing how many people smile back. You might get some funny looks, but you'd have to, in your session with the client in advance, figure out, well, what exactly will the homework be? And how are you going to keep track of your results? And then, bringing that information back to the next appointment and figuring out, well, what exactly does that mean? And then maybe replicating it, doing a retest of it. And so, you can apply that to many different kinds of homework. And a useful strategy in the session too, you can start the homework in the appointment. You can, start keeping track. You can incorporate your clinic. If you work in a clinic with other people, you can have a client do part of this in the waiting room, for example. If you have a busy waiting room, you can, build that in.
Okay, Deb, I want you to do a role play with me
Okay.
right now. So I'm a client, and I say to you, Dr. Dobson, we role played that. I kind of walked to the mall, but I just couldn't do it.
hmm
It's just too hard.
hmm
What can I do?
Well, that's a really good question, Michael. I think that a lot of people find these homework assignments pretty difficult. And, it must have been when we set the homework assignment, maybe I might have forgotten to ask you, how hard do you think this would be? Because I think that it's important to understand in advance kind of what your thoughts are on it. And so, I'll take part of the responsibility for that difficulty. I think, and when we discuss whatever homework we'll have from today's session, I'm going to ask you some questions, like how confident are you that you'll be able to do the homework? And it sounds like you didn't feel very confident when you were in the mall. And so what did you learn from that? That it was too difficult? Can you think about anything you learned from your
Mhm.
experience?
Well, I'm wondering, now I'm not the client
Yeah,
anymore,
okay.
back to Michael again, what the smallest steps might be for clients who are having a hard time,
Mhm.
and you know you can't push them into doing what you had hoped or what you thought they could
Yeah,
accomplish. What are some of the smallest steps that they could do to show that there's some hope there?
yeah. A really good question. I think that it's really important to start with small steps and steps that are manageable and doable for a client. And so a first step might be going into physically into a public space. Just being there, being around other people, because it's easy for people who are socially anxious and avoidant to spend days without being in the presence of another person. And so it could be a step online, for example. It could be turning your camera on for a couple minutes. It could be going into a public place and looking at people, not interacting with them, but looking at them, just keeping track of what's going on, looking up rather than down. And so we can break it down into very small steps. It depends on the degree of anxiety that the client has. And so, some clients will be able to interact, maybe say hello to people, engage in eye contact, have a conversation. Some people won't. And some is breaking it down into very small steps. And another thing that's important is repetition, because if you do one big thing once every 6 months, it's not going to help you a whole lot. If you have to give a lecture, for example, to a crowd in an auditorium once every 6 months, you still might be socially anxious because you haven't done it often enough. The way I got over my public speaking anxiety was signing up to teach undergraduate students at university. You know, just about did me in, but it cured my public speaking anxiety.
Well, you're doing very well now.
Oh,
I'm just
thank you.
wondering if maybe one other question after this one, but are there other specific skills or techniques that you'll be teaching in the webinar
Mhm,
that you think are particularly useful for therapists, whether or not they have CBT backgrounds or not?
mhm. I would say identifying and dealing with avoidance, identifying and dealing with socially anxious thoughts, and then helping clients take ownership of change. Those would be kind of three areas I think would be important for all therapists. And well, can I have four?
You can have as many as you like. Here can be
I
a long
was
webinar, longer than this.
The more I talk about it, the more I think of. I think, you also often have to deal with secondary issues like depression, like, things that arise out of social anxiety. And for many years, we used to deal with some of those secondary problems first, but I think it's important to deal with the underlying issues of the social anxiety. And so really digging down and finding out what's driving some of the secondary problems is important.
And my last question, and then everyone watching can put a question into the chat box, or you can just tell Emily in the chat box you'd like to come on the screen and speak directly to Deb. You've been involved in peer support initiatives.
Mhm.
What role do you think peer connection plays in healing, and what do some of those peer support initiatives look like?
I think that's really important. And we were talking earlier about, how can we keep the change going? And, peer support is a great way to keep the change going. I think, peer support groups, I had the opportunity to start a community support group a number of years ago through the Canadian Mental Health Association here in Calgary. And a couple of former clients were involved in starting a group where they really focused on practicing skills. Now, unfortunately, the group, I don't believe it continued anymore, but I think there are if peer support groups, I think I would say to clients, you have to check it out closely. Some peer support groups tend to be mostly complaining about public health systems. Whereas, good, sensible, proactive peer support groups, if they're focusing on how can people continue to move forward, I think are great for people.
Or you need some good group leadership skills
Yeah,
in
yeah.
keeping it from being let's just complain, but
Hmm.
having to move it into positivity and action. That's
Exactly.
something, yeah. Okay. Well, I'd like to see Emily. Do we have any
We
questions?
do.
Over to you.
Yeah. So the first one was for those with social anxiety and depression who struggle with motivation and shamefully report that they didn't do the homework or exercise outside the session frequently. What is an effective way to manage this scenario from your perspective?
Hmm. I think that homework is difficult. I thought for years about what other word we can use for homework because, you tend to associate homework with school and assignments and a judgment. And so first of all, any efforts at homework should be positively viewed and acknowledged by therapists. So it might even be I thought about the homework or I was doing I used to, it was quite entertaining because when I was doing groups, clients often were sitting in the waiting room doing their homework together. And I thought that was great. They'd sit there, they would practice. And so, reinforce homework and, make it clear that it's not being judged. They're not passing it in. It's not like an assignment. They don't have to show you their homework. And so if clients can take a mindset such as that they can be open to making efforts. And, I think that, and I encourage clients to make mistakes in homework because if you make a mistake, we can't learn new things that are difficult without making mistakes. So if you make mistakes, that means you're taking a risk. It means that you're really brave. And we can't underestimate sometimes how difficult some of these steps are for clients to take. I think things that we may see of as quite easy can be very, very difficult for some clients. And so really doing all that acknowledgement.
Thank you. We did have an audience question from who I believe is unmuted. Hi.
Hello, is that me?
Yes, that's you.
Oh, wonderful. I can't see myself on screen right now.
Oh, I can see you there. Oh, I saw you momentarily anyway.
Okay, that's wonderful. You know, thank you to you, Michael, and your team for providing us this opportunity to chat with Deb. Um, Deb, I was delighted to hear the first part of this chat. And I'll explain why. I'm a psychodynamic psychotherapist. And I also am a clinician as a chiropractor as well. So anyway, I use my left brain and my right brain quite a bit in a variety of ways. And that's why um, my question will highlight why I'm explaining this. You're the first person that I've heard to who is talking about CBT and her work in that or their work in that, where I feel, oh, I could use that uh, with what I am using. And the reason is the one word that came up for me is the word holistic, in that, and in contrast to me, CBT approaches have been very much like that test, very much like that homework, very much the step by step thing, if you see what I mean.
Hmm.
Do you? Okay, that's great. And it is easy for me to turn into a teacher, as it were, like when I'm dealing with myself or with someone else. But it is also not not quite appropriate in many ways with the type of work I do, or even in being kind to myself, I would say.
Hmm.
uh, or thoughtful, well, I'm learning thoughtfulness or have over the many years. So the reason I'm saying all of this, I can't give you an example, but the way you holistically flushed out the questions Michael directed to you, or even Emily right now, I'm hoping that that will persist as or I'm hoping that that is part of the workshop or seminar you'll present, because I find myself very interested in taking this. And I
Mhm.
also want to thank you for this very warm, compassionate aspect, because I agree with you. Social anxiety is a significant problem, number one. And number two, requires its own skill set and its own sort of, step by step markers to encourage the person, but yet done in this holistic way that I could perceive with you sharing that.
Mm.
So
Yeah, thank you. Yeah. Good.
Hmm.
so it's more a comment, and also speaking about my hopefulness at that,
Well, I hope to be fleshing out all of the things that we're talking about, and I hope to be able to do it in a well, we have a fairly short period of time. And so, but yes, for sure. And, I think that we must remember to be very compassionate with our clients and remember the difficulties they're facing and, really not, I think, you talk about, CBT, we try to be step by step. I've always struggled with being step by step. I think that, I think there's lots of treatment protocols that have been developed that, one tries to follow, but often, clients bring their own issues and their own individuality. And so I think it's both the combination of steps and really taking advantage of the situation that the client presents with. One of the things a phrase I like, and I, have to give credit to Nina Josephovich in Toronto. Some of you may know her. She and I have done
Mhm.
some workshops together, and I forget if it was her or I that came up with the term. I think it was her actually, random acts of exposure. I think that, we've all familiar with the Random Acts of Kindness campaign that was launched by Canadian Mental Health Association and was taken, I think, globally. You can see reference to that. But you can think about random acts of exposure. So taking advantage of situations that present themselves. And that may be that your client sees or that you see in the session. I think that doing a spontaneous role play like Michael and I just did a few minutes ago, I think that, and, I hope to, in the workshop, we will have a very structured approach with all the slides and so on, but I hope to make it individualized enough, depending on the number of people that are there, to be able to individualize it to the needs of the participants as well.
If I may, as you're speaking, it landed for me that actually it's not only giving them this exercise or working through that, but actually the way you were sharing information as how I may use it is in that I can work with other aspects of that person's personality or situation, which actually nurtures and moves them forward psychodynamically as well in other areas.
Hmm.
you know um so that's all. It
Hmm.
gives me the sense that you may have a sense of how that whole personality or would wish to work with how their situation and personality in other areas could
Hmm.
also be aided in the specific narrow CBT sort of needs. I think I'll
Hmm.
finish there, but
Thank you.
Thank
whatever you
you.
can get from
Thank
that,
you so much
that would
for
be
your
great.
comments. Yeah.
Thank you. Yeah.
And actually, that leads very nicely into the next question, which is, can social anxiety techniques also work with confidence building?
For sure. I think that they go hand in hand because I think whenever a person, and if you think about ourselves, if we do something that is difficult and that builds confidence. And I've said to people many, many times, the only, or I would say maybe the best way to build self-esteem is to do hard stuff. I think that we can talk endlessly about self-esteem with our clients. It's not going to help self-esteem very much. I think the only way to build self-esteem is to do something difficult. And so if the client is using techniques, using strategies, reducing avoidance, working on social skills, initiating relationships, and they come in having done some of that homework and making a comment, if you were afraid of that and you've done it, you'll be less afraid of it in the future. The more we do things, the more confidence we have. As long as we are aware of that, and that's the job of the therapist to point that out to the client as they're doing the practice. And so they go hand in hand.
Um, and then someone asked, how do you best deal with the situation where the client has a negative experience, which reinforces the anxiety? So,
Hmm.
for example, someone goes to a party and no one talks to them.
Hmm. I think that just like Michael's situation where he went to the mall and it was too difficult, I think that happens. Clients, that's their biggest fear is they will be rejected and they may perceive nobody talking to them at a party as rejection. And so it becomes grist to the mill. I think that it's important to try to build in, excuse me, build in situations that are relatively easy to start with. Not, we can't control other people. We don't when, it's one of the tricky things about doing exposure therapy for social anxiety because it doesn't involve static situations. A person may say hello to someone and they say hello back and then they start a conversation that the person has no idea what to say next. And so I think it'll happen and it's important to go back and try something again. You may scale it back. And I think, what I did with Michael is I will take part of the responsibility for a homework exercise that was too difficult. And, we share that responsibility and we build on it.
Great. And then someone wants to know about the role of social media and social anxiety, whereas they're discussing that social media has an influence on younger people with increased isolation and avoidance, as well as generalized anxiety. So, how does
Mhm.
that impact people's experience with social anxiety?
I think it has a huge impact, and I think we're probably only learning about it. All the things that you just mentioned there, but also the standards that are shown in something like Instagram. People post perfect pictures of their perfect outfits and relationships and all those things that lead to very unrealistic expectations. And so I think there's a bit of a kickback to that. I don't know how this came onto my social media feeds, but it's called Dull Women. And so, people are posting really, really boring stories of really boring, dull things that they do. And so that's a bit of a kickback, I think. But I think it plays a huge role. And in avoidance, in expectations, in, all the algorithms that, people get that are giving them not a good, expansive view of the world. So I don't know what we can do about it.
Mm. And if you're working with a child that you're noticing is experiencing social anxiety, are you using similar strategies? Are you modifying them? What types of tricks and
I
tools are
have
we
to
using?
I have to say that I'm not a child psychologist. I've never worked with children. I sometimes will say to people in training, I was a child and I have had children. That's my experience with children. And so I would, but certainly I think they are applicable. I've worked with older adolescents. They're all applicable, but I would think with children focusing more on behavioral strategies rather than cognitive strategies would be a place to start.
Thank you. I'm not seeing any other questions currently, unless anyone has a last minute question or wants to raise their digital or their virtual hand.
Well, we'll give it another few seconds. If anyone would like to ask or come on the screen, please let me know. Otherwise, we'll get ready to end this. Okay. Well, I want to
Oh,
thank you.
wait, Peter has
Oh,
his hand
hold
up. Hi,
on.
Yeah,
Peter.
I have a quick question. Yeah, so I'm an EMDR therapist. So I do a lot of work where it comes to desensitizing past traumas or adverse life experiences. Can you maybe just speak about how that may elaborate in terms of a person's past and so forth, and the past traumas that they have that are now possibly showing up present day in the form of social anxiety? And maybe can some of the material that you're teaching in your 2-day workshop next month could be meshed with EMDR theoretically?
Well, I would, in terms of meshing CBT with EMDR for social anxiety, I would probably leave that up to you, Peter, in terms of making that decision after hearing what I say in the workshop. Certainly, lots of people with social anxiety have had, past situations that were traumatizing. I think looking at definitions of trauma, I think that I can think of lots of times. There's been some looking at, did people have social traumas? And I think that lots of people with social anxiety experienced bullying as children, experienced humiliation, shaming incidents as children. I'm not a EMDR practitioner, so I don't know if that's something that you might consider using EMDR for. I've always been of the mind, help people function in the present situation, improve their present life first, rather than dealing with past trauma. But again, that might be a difference between different therapeutic approaches.
So, Deb, it's been a real pleasure. I want to thank you for joining us. And you can have one comment before you open up all the microphones in front of people. No more muting, and they can say their thank you. We have a cacophony of goodbyes and thank you. So, Deb, thank you.
Thank you. It's fun.